the August gathering regarding my unforgettable visit and interaction with the great Colossus, Dr. Basu, about whom I had heard so much from my professors while I was doing master's training in International Institute of Acupuncture, Mumbai, in early 80s. Coincidentally, I visited him at his Hazra Road Acupuncture Clinic. After self-interaction, we interacted about the recovery status of my beloved mother, Sri Surendra Nath Dwivedi, the then Vietnam Society leader and members of parliament, who had come for his acupuncture session for low back pain and sciatica. I was keenly observing his commanding style of needling, activating the vocal response of the patient as well. After the session, to my utter surprise, he told Dwivedi uncle to continue the rest of the session at Raurkela with Dr. Nayak. Possible, he had developed confidence in me. Thus, I was magnificently blessed, and he wished me all the very best, and I gratefully thanked him for his inspiring benediction. With this, I have great pleasure to invite Dr. Bhaskar Jyoti Bhattacharya to present Dr. B.K. Basu Memorial Oration entitled TCM and Modern Medicine Similarities. Thank you very much for patient hearing.
Good morning. We are meeting physically after long 3 years. Though it is not an inaugural session, it will be a little later. But I am the first speaker. So welcome you all in this conference. And I am very happy that so many people from all over India are attending this conference. So, and another point is that those people who have come here, many new faces are there, who has come to enter the family of acupuncture within short years. We are people with acupuncture for long periods. Sometimes it was aggravating, sometimes it was declining. But now, seeing so many people, we are very happy that we think the good days of acupuncture is coming ahead. So, thanking you all. I am starting my speech today, Dr. B.K. Basu Memorial Oration. Definitely it is a prestigious speech, and I shall try my best to convince my subject to you. It is very relevant in modern days. Today there is a prominent debate whether TCM or modern medicine. There is no contradiction between the two. Problem is regarding our conception. One thing must be clear here, that modern medicine is not allopathy only. Modern medicine means modern scientific medicine, which is based on science. Now, in 21st century, people try to explain everything by their scientific knowledge. All the theories of TCM are based on different natural phenomena developed in thousands of years before. Science was not advanced, so people developed the palliative and curative therapy based on perception and evidence mode. Record was not kept properly, came some myth with science. So we cannot say every understanding of those days are scientific. The ancient physicians tried to understand human body as a part of nature, as a whole. We modern people try to understand it like peeling of an onion from outside inwards. But the goal is same in both the cases, to give people maximum relief from morbidity to reduce mortality. Let us come to understand the proposition from theoretical and practical understanding. The essence of TCM. The essence of the traditional Chinese medicine is the knowledge that can impact the direction of future modern medical development. The basic structure of traditional Chinese medicine, it is composed of three parts. It is very important to understand. One, consistent with modern medicine. One that needs to be further evaluated. One, involuntary beyond modern medicine. So, I think we should understand these three parts very clearly. The part which is consistent with modern medicine is very clear to us. Later I am coming to that. And the evaluation can be also clear, but the involuntary beyond modern medicine, it is little bit difficult to clear. The essence of traditional Chinese medicine has always been the most advanced and experienced medicine in the world. Its vast system is full of practical medical technology and proven experiences that have been gradually incorporated into modern medicine. So the first part, the part consistent with modern medicine, can be explained fast with an example. We know vitamin D enhances immune function and reduces spread of some viruses. Recent evidence shows that blood calcium level is strongly associated with COVID-19 severity, and vitamin D supplementation shows favorable effect. According to TCM theory, the pathogenesis of COVID-19 is closely associated with cold dampness, an etiological factor in TCM. Cold dampness can be attenuated by sun exposure and William halves. It is a half found in China, both of which can restore vitamin D level in the blood in Western medicine. Second, the essence of kidney. The essence of kidney is core concept of traditional Chinese medicine. Kidney deficiency syndrome is equivalent to aging in modern medicine. This is one point. Heart G deficiency is associated with cardiac insufficiency in modern medicine. These are few examples just I am telling you, which are little bit consistent with modern medicine. The use of auscultation, olfaction, including listening of sound and smelling of odor, is also consistent with modern medicine. If you go through the case taking in TCM, you will get these three things: olfaction and auscultation and smelling odor. Everything is there, and also in case taking in modern medicine, all these things are there. The patient speaks loudly and powerfully. The physician can determine that the patient is full of energy. Conversely, if patient's voice is weak or he does not want to talk, it is most likely that the patient's disease caused by deficiency. So we can explain these parts in this way, consistent with modern medicine by TCM. Consensus of several treatment of traditional Chinese medicine, therapeutic studies show that Chinese medicine and modern medicine have taught a consensus on the method of diaphoresis, purging, vomiting, warming, clearing, neutralizing, eliminating, and reinforcing. These are some of the functioning of ours which are always not normal. When there is diaphoresis, when there is purging, when there is vomiting, it has some etiological cause. And that is true for modern medicine and also for TCM equally. So we are working with all these things in both the subjects. For instance, the reinforcing method, it is able to improve neuroendocrine regulatory function, enhance the body's ability to combat stress, adjust immune function, and improve the body's systemic function. So these functions are accepted in modern medicine, but we are explaining why TCM these functions. In this way, we can look into the matter. Consensus on several prescriptions of traditional Chinese medicine and commonly used Chinese herbs. Illness cured by many ancient Chinese compounds are similar to certain medicines used to treat certain diseases or conditions seen in modern medical practice. I shall give the example later. You also know that. I come in little later. The part ahead of modern medicine, involuntary, is second part. Modern medicine has the view, nature that cannot be certified, cannot be conquered. In such a sequence, TCM with the overall aid and simple features involuntarily gives awareness beyond the era. So, one thing we are finding that the domain of TCM much more enlarged than modern medicine. But I am telling that we shall stand at the border where the modern medicine and TCM can stand side by side. The later part can be discussed later on, that can be explored later on, but that part can be done simultaneously. Traditional Chinese medicine has significant contribution to modern medicine. For example, the theory of the correspondence between man and universe in traditional Chinese medicine. You know that. Here it is unified outlook of body and environment. In modern medicine, if you have seen in physiology, there is a chapter homeostasis. So it is also telling that the universe, in how we are adjusted with our environment. What are known as biological life and biological clock theory in modern medicine refers to the pattern of hormone secretion and treating diseases according to the place of origin are all the embodiment of correspondence between man and universe. We have biological clock, we know, that is called Chinese organ clock, and that is biological clock in our life pattern, which is governed by pituitary hypothalamus axis. So both are working similar pattern. Studies by Shen show that kidney deficiency is due to neuroendocrine disturbance and pre-aging of functions of hypothalamic pituitary axis, which is consistent with the hypothesis that senile bell lies in hypothalamus, proposed by Everett in 1980. So this axis, hypothalamus pituitary axis, is equally relevant to modern medicine and TCM. Same treatment for different diseases. That is very important thing. One of the most important and characteristic concept in traditional Chinese medicine reflects the spirit of syndrome differentiation and treatment, and refers to the thought that different diseases at certain stages of development show the same pathogenesis, and therefore the same therapeutic principles can be applied to diseases. In this concept, I can tell you that in other traditional medicine also we see that in different diseases we can treat similar with same medicine by seeing that your disease pattern and symptoms and all these things. That is also equally true here. According to modern medical diagnosis, different diseases are able to be cured by reinforcing kidney and replenishing qi. as long as they are attributed to kidney E deficiency syndrome. It is from TCM, but we are speaking about the kidney and it is accepted. In a very gross way, I can tell you that when some problem comes in the aging, kidney is the first organ to be involved without any definite pathology. So this same kidney deficiency can one of the criteria of the aging in man. Modern research has shown that concept of same treatment for different diseases is likely to be one of the directions of modern medicine in future. Because some of the walls that exist between diseases are not always reasonable. The reason for division is often based on anatomy rather than etiological and pathological changes. That is very important. You see, when in modern medicine we go to some specialist, somebody is working with eye, somebody is working with ENT, somebody is working with the brain. Like this, more divisions are there. But problem is that maximum of the pathogenesis originated with a single point, from a single point. From a single point. The study of Chinese medicine is driven in part by development of modern pharmacology. For instance, I am coming to that example I told earlier. The Artemisia annua was recorded as drug used to treat malaria. Modern research has shown that it has an anti-malarial active ingredient. So you know, a Chinese doctor got Nobel Prize working on this. And it was a very old story that in a village there was no malaria or no fever patient, because when fever comes, they go to the wood, go to the forest, and they take some herbs and the fever is reduced. That is Artemisia. In the same family which in Moksha use Artemisia vulgaris. So same thing, Artemis injection is being used in malaria. Same thing is Artemisinin. All these things are used in modern medicine. The same thing also we are using. Massage treatment. As for example, Tuina utilizes the particular skills with hands or limbs to practice manipulation on surface of the body. Therefore, it has the direct effect of activating blood and dispersing stagnation. Massage reflected influences neuro and body fluid by acupoint, meridian, viscera network. Modern research studies show that massage can promote blood and lymph circulation, increase metabolism, the repair of soft tissue injury. Some parts of the TCM, it is third part, need to be newly recognized or abandoned. The initial base of modern medicine and traditional Chinese medicine were founded in specific culture and time. The TCM theory should be divided in two parts, one of which needs to be promoted, the other of which needs to be abandoned. Integrative medicine is an important way to achieve this. Everybody may not be, may not think similarly like me that abandoned, this word is not good. But in saying abandoned, I want to tell that these things, some things must be proved more with our modern knowledge. After keeping everything in mind, we can tell that any disease could contain two parts of appearance: specificity, such as pathological changes; non-specificity, as heterogeneous manifestation. Modern medicine explores the specificity of morbidity, while TCM is mainly aimed to explore the reality of morbidity by differentiation of syndrome, exploration of multiple factors. That is not possible in modern medicine. At present, combining the differentiation of syndrome with diagnosis of diseases, TCM mainly targeting non-specificity and modern medicine targeting specificity can produce best therapeutic effect. Part of TCM targeting non-specificity are supposed to be abandoned from the field of modern medicine at present. At present, but in some day definitely we shall explore that. As we are discussing mainly with acupuncture, another part of TCM remains unexplored. That is herbal medicine, which is profoundly used in China, but in our country we are not using simultaneously. Many clinical studies have shown that combining modern drugs with herbal medicine or acupuncture will increase the effect. More double-blinded clinical trials need to be conducted both for modern drugs and acupuncture with or without herbal medicine. It is very tough task. Here I uttered the term modern medicine to place the therapy based on our modern scientific knowledge. The assessment of therapeutic process of integration will not end here. It will continue. The idea of this paper is whatever the practice should definitely have a scientific explanation. We cannot keep away from integration with modern scientific medicine, but our approach must be rational. Thank you.
Thank you, Dr. Bhattacharya, for your very nice deliberation. B.K. Boshu Memorial Oration completes here. So I request Dr. Naik to please hand over the certificate and memento to Dr. Bhattacharya for his beautiful lecture. Please, a big hand. It's a special memento for this oration and goes to our General Secretary, Dr. Bhaskar Jyoti Bhattacharya, presented by Dr. K.S. Naik. I request Dr. Naik to please come up to the stage and just felicitate Dr. Naik, the chairman, to hand over. The president of AI, Dr. Naik, will hand over the memento and certificate of chairmanship to Dr. K.S. Naik. We have on dais three dignitaries of AI: President, General Secretary, and Vice President. President is Dr. M.N. Naik, General Secretary Dr. Bhaskar Jyoti Bhattacharya, and Vice President Dr. K.S. Naik. So I request, it's a release of a book of Dr. Vijay Kumar Basu, and it's titled A Great Humanist and Internationalist. It's published by AAI. So we are honored to release such a prestigious book on Dr. Basu, and I request on behalf of AI, the President, the General Secretary, and the Vice President jointly please release this book for the audience. And the name of the book, I told before, A Great Humanist and Internationalist, published. Dr. Vijay Kumar Basu, A Great Humanist and Internationalist, published by AI. So we thank them for being on stage, and I request Dr. Naik to please stay on, as because next will be the keynote address by Dr. M.N. Naik, Mrigendranath Naik, the President, Honorable President of Acupuncture Association of India. Just before starting the session, I request The next speakers for the first scientific session, Dr. Probir Banerjee. The next speaker, Dr. Buddhadev Nath and Dr. Rochita Chopra, to please submit their PPTs beside the stage so that there is no delay in starting the program. Dr. Probir Banerjee, Dr. Buddhadev Nath and Dr. Rochita Chopra, please submit your PPTs onto the person responsible so that we can start the next program very soon. So it's honor and time for the keynote address by Dr. Mrigendranath Gandhari.
All my professional friends and guests, in this gathering of acupuncturists from various parts of India and abroad, I like to speak on a matter which you may call acupuncture in future, or I may call in a generalized way medicine in future. There is no doubt that acupuncture is an effective therapy. Its efficacy is visible with naked eye when we see that gangrene of limbs is healed up with acupuncture, joint swelling of arthritis is reduced. Such an effective modality of treatment has its theory, which is very old because it is a traditional art of healing. Besides acupuncture, there are many other effective therapies in the world, such as allopathy, Ayurveda, Unani, homeopathy, and so on. All these therapies have their own theories, which are quite different from each other. There is almost no point of synthesis of these theories. Now, can we think of any common theoretical frame to explain and to correlate all the modalities of treatment? If we look at the general science, which is mother of all sciences, we find that searches are going on to get unified field theory of the universe, which would be called the theory of everything. We know there are four fundamental forces in the universe. These are gravitational force, electromagnetic force, strong force, and weak force. In physics, these forces are called field. Every happening of the universe is due to interaction between separate objects through mediation of these four fundamental forces. Thus, they are interrelated with each other. Research is going on to get these fundamental four theories in one theoretical frame that will be called the theory of everything. Similarly, can we try to get unified theory of medicine? I think it would be possible if we analyze the effects of application of each therapy in the minutest level of body tissue, which may be called nanobiology. Then naturally, theory and mechanism of action of each therapy, including allopathic medicine, each therapy has to be expressed in new terms. In this gathering of acupuncturists, I like to submit a hypothesis. It's not the thesis, but hypothesis. What would be the probable theory of acupuncture in the light of proposed unified theory of medicine? Let us take acupuncture first. Acupuncturists prick needles at various sites of body called acupuncture points. The acupuncture points are said to be situated at some meridians. Physical existence of these meridians or the imaginary energy flow called chi are not yet demonstrated. In reality, while doing acupuncture, what is being done? A living being is punctured by some fine stainless steel needles at certain sites of the body. That is acupuncture. We forget China, forget TCM, forget anything. This is nothing but a living being is punctured by some fine stainless steel needles. The person feels some sensation which is due to mainly sensory nerve stimulation. So, the input is nerve stimulation and the output is relief of symptoms. That is the effect. Input is nerve stimulation and the output is relief of symptoms. Therefore, nerve stimulation can be linked to the therapeutic effects. It has been clearly demonstrated that acupuncture needling creates stimulation of nerves. Nerves have intermingling and overlapping connections. So, stimulation in any part of nerve force, dendrite or axon, whatever it may be, should produce same effects. Thus, it may be called a selection of nerve, not selection of acupuncture points. The present trends go in favor of such method, which has been described as area stimulation rather than channel or point stimulation. So the concept of channels and points having therapeutic effects may be changed in course of time. For example, in a case of hyperglycemia, a part of body will be selected where if nerve stimulation is given, that will stimulate, that will whip the beta cells of pancreas to secrete more insulin. Then there may remain no consideration of chunk organs, damp cold heat invasion, or the five elemental interactions of organs. With the help of modern scientific gadgets, effects of nerve stimulation, that is acupuncture procedure, can be tracked to the minutest level of the body, that is cells, synapses, and intercellular space. Different systems of medicine with their theoretical frame had evolved due to observation and explanation of body functions from various angles. They all are truthful in their approach, but they describe the elephant in various forms. Means like some blind people are seeing an elephant, someone is telling it's like a pillar, someone is telling like a fan, like that. So they all describe the elephant in various forms. Can there be any further concrete view to see and explain body functions through one window or one parameter? The parameter would be the changes in the nanobiological levels of tissues. Each effective therapy should produce some changes in nanobiological level. We can easily relate such changes to the particular mode of therapy. Then we can compare and correlate various systems of therapies on the backdrop of nanobiological changes. As happens in general science, there are various forms of expressions such as light, heat, sound, magnetism, electricity, movement of objects, such and so on. But we all know that they are all various manifestations of only one thing, that is energy. They are interrelated and interconvertible. In a further simple example, we see that diamond and graphite are diametrically opposite in their look and texture, but in essence they are made of carbon and only carbon. One looks like graphite, very fragile, and one is diamond, very hard and so shiny. But they are only carbon and only carbon. In course of time, maybe a few hundred years later, I think medicine in the world will be one. That will be possible due to furthermore exploration of internal structure of matter. Matter is the building unit of body and mind. Then therapeutic effects of all systems of medicine will be explained in one framework, that is nanobiology. Now the medical world is divided into various communities such as allopathy, homeopathy, Ayurveda, Unani, etc. And there is communal rivalry. Allopathy will blame the homeopaths, homeopaths will blame the allopathists. There is communal rivalry among the medical community. We may hope in future such medical communalism will end. Let us hope so. Maybe then there will be no conference of acupuncturists. And for that, we need not be sorry. Thank you all.
Thank you, Dr. Gandai, for your learned deliberation. And now I request all the three of the dignitaries are here, means the President, the Vice President and General Secretary. So I request you three to please garland the picture of Dr. Bijoy Kumar Basu, the founder father of acupuncture in India. So it's the garlanding ceremony. As you know, this is our 19th national conference. The first conference took place in 1980 in Kolkata. The second one also in 82 in Kolkata, and then onwards. So it's the garlanding ceremony. And now I request our President, Vice President and Secretary to please take their seats in the auditorium. And we proceed to the first scientific session. But before starting, I request all the speakers from today and tomorrow to please keep to their time limit. The time limits have been given to them. So we are actually to accommodate a large number of papers. Already 39 papers are there. So we had to accommodate 39 papers. And so please keep to your time. Don't exceed your time. If you keep within the time, it will be easier for us to conduct the sessions. Otherwise, we will be running very late. The first session, two speakers have already given their PPTs, but I request Dr. Buddhadev Nath. Is he present? Dr. Buddhadev Nath. So please give your PPT here. You have already given? Oh, fine. That's okay. So please be ready. We call upon Dr. Ashit Haldar, and Dr. Taposh Pal onto the dais. They are the chairpersons for this first session. Dr. Ashit Haldar and Dr. Taposh Pal. Now let me introduce Dr. Ashit Haldar. Dr. Ashit Haldar is the old young man and is the enthusiastic secretary of West Bengal State Branch. And it's his endeavor and his activities that made us work hard to organize this conference in Kolkata. And next but not the least, Dr. Taposh Pal. Both are ex-MO Acupuncture of Government of West Bengal. And Dr. Taposh Pal is also a council member of Acupuncture Council in West Bengal. and one of the senior acupuncturists. So after this brief introduction, I call upon Dr. Probir Banerjee and the three judges for the free papers will be Dr. Vinay Verma, from Hubli for the Govind Ram Verma Award, Dr. K. Naik from Orissa for the award from Orissa, second award, and the third award, it will be judged by Dr. Pardeshi. These are the three judges for the sessions, or the free papers rather. Not all papers, but free papers. So, I request Dr. Probir Kumar Banerjee to please come on to the dais and present his first paper. The paper is Acupuncture Anesthesia in Dental Extraction. Your time limit is 8 minutes. If you can speak within 6 minutes, then 2 minutes question answer. If you complete 8 minutes, then no question answer, please, because next is inaugural session and we are already late. Dr. Probir Kumar Banerjee. Some technical problem is there. The PPT is not coming up, so please. Just bear it. Just bear it with us. We are sorry, it's just a technical problem. अच्छा অন্য কোনো প্রজেক্টরই আছে So sorry for the delay. The first paper, Anesthesia, Acupuncture Anesthesia in Dental Extraction by Dr. Probir Banerjee.
Deputy Consul.
In my great opportunity, submit some papers relating to India. Now to proceed, we starting now. Our first session is acupuncture anesthesia and dental extraction is the topic. Its introduction is starting. The extraction of tooth is one of the most painful procedures, and pain during extraction makes a horrible situation to the patient. Hence, it is a major concern to the dental surgeon. Various methods have been made from time to time which eliminate pain during extraction. Local analgesic drug have been applied to achieve painless extraction. So, acupuncture anesthesia is a method of inducing anesthetic effect through needling for a surgical procedure. It was implemented in the 1950s. It originated from traditional Chinese medicine and is considered as one of the most important achievements in modern science. In dentistry, most tooth extraction using acupuncture anesthesia are completed in less than 15 minutes. But difficult extraction needs combined acupuncture anesthesia and local anesthetic drug. Traditional Chinese acupuncture is one of the best known complementary and alternative therapies. Acupuncture stimulates the nervous system and alters the processing of perception of pain signals and also releases natural painkillers such as endorphins, serotonin in the nervous system. Acupuncture successful use for various dental conditions has been proven. So we decided to conduct the present study, a comparative study, to review the role of acupuncture analgesia in tooth extraction and to compare the effect of acupuncture with lignocaine injection. Next, materials and method. The present study was conducted on 16 patients of varying age and sex requiring at least 2 teeth extractions were selected from our hospital, Bosira District Hospital, North West Corona, and this is a super specialty hospital. In this study, we excluded the children and extreme old age patients. They are not included in the study due to the difficulty of explaining the acupuncture anesthesia and its technique, its procedure. In each patient, 2 teeth are extracted, one under lignocaine with adrenaline injection, 2% lignocaine, 1 in 1 lakhs ratio, and other under acupuncture extraction were done under the interval of 7 days. We take the difference between lignocaine injection and to the acupuncture anesthesia. The differentiation period is 7 days. In acupuncture group, the stainless steel needles with silver plated handles of 2 different sizes, 1 and 1.5 inch, and their gauge or diameters is 28 and 30 are taken. The selection of points, the nerve supply of the teeth. The upper teeth are supplied by posterior, middle and anterior superior alveolar nerves, which forms a plexus above the epicenter of the teeth or superior dental plexus. And the lower teeth are supplied by inferior alveolar dental nerve. The molars and premolars are supplied by the male trunk, while canine and incisor by its incisive branch. Selection of points. For upper jaw, local points as taken E26 Renchong, Li19, you know Li19, Polio, Li20, Yin-Xiang, Stomach 40, Pichang, and SI18. Chuan Liao. All these points are suggested for upper jaw extraction. For lower jaw extractions, we suggested ST5, the 9, CH8, stomach 6, and for distal points, We have taken LI4, stomach 36, Sushandi, and Nating, stomach 44. Stimulation was performed by needle manually or electrically. Needle on LI4, 36, 64 was stimulated by either manual or electrical. Mostly electrical stimulation are given. The stainless steel needles are inserted to an appropriate depth at the acupuncture point after skin sterilization. Then the needle are connected to an electrical stimulator. Electricity was generated as output of programmed pulse. You know the pulsatile is already programmed 1.2 Hz with a regular wave of 6 volt low frequency battery. The acupuncture, electroacupuncture was applied for 15 minutes for induction and then converted to a 15 Hz dense disperse wave to maintain anesthetic effect of bearable intensity using electrical pulse for 80 to 110 seconds. Mechanism in action, in modern theory, you know how it works, and mechanism of action as per TCM theory. The selected acupuncture of points on extremities including bilateral Boku LI4, Tushanli, and anything stomach 36 or stomach 44. Stainless steel acupuncture needles are inserted to an appropriate depth at the acupuncture points after skin sterilization. The needles are manipulated by rotating back and forth, during which the patient should have a sensation of operating itching. The patient feels heaviness, soreness, numbness, distension, and even sensation like electric shock. Two general principles of treatment to reinforce the patient's healthy chi and eliminate the invading pathogenic factor, which can be applied separately or in combination according to the particular conditions of the case. First, we selected LI4. Why we selected LI4? We selected the acupoint on both yang ming meridian passed through the gingiva. The source point, LI4 is the source point where the original chi of the visceral organ food pass or stay of the large intestine meridian. It is involved in heat clearing and fire purging. We are taking stomach 36 Tushanli due to its effect to the C point of stomach meridian or channel, one of the 5 transport points. It affects the freeing meridians and collaterals, harmonizes chi and blood, and reinforces the quality chi and eliminate the pathogenic factors. And stomach 44 is the young point out of 5 transport points, mostly located distal to the metatarsal phalangeal joints and involved in heat clearing and fire purging as well as moving chi to relieve pain. This is the observation and results. The observation and results, we are showing that the onset of analgesia, the mode of analgesia, next time, the mode of analgesia, acupuncture showed no sensitivity reaction and no sensitivity test was required prior to insertion of needle. It is been proved that all local analgesics should sensitivity reaction either immediate or delayed. A sensitivity test is necessary in case of local analgesic because of danger of anaphylactic shock of lignocaine. This is more painful to the patient and time consuming. Acupuncture anesthesia has a number of advantages. It is safe because it is non-toxic, minimal adverse reactions, no dependency associated with narcotics, simple and convenient, is performed by a well-trained acupuncturist. Look this video. This is the first patient. This is the second patient. The third patient. The third patient continues his surgery. The fourth patient, to give her the acupuncture anesthesia. It is running now. Proceeding. Thank you everybody. Short time it is produced to take some time. Thank you everybody.
So next speaker I call Dr. Buddhadev Nath. Dr. Buddhadev Nath, please present your paper, Acupuncture as Soft Tissue Mobilization Technique. Dr. Buddhadev Nath, please come.
So good morning all of you. Let's start the topic. So my topic is use of acupuncture for the soft tissue mobilization. So there are various techniques and tools to mobilize soft tissues in our body. So soft tissue mobilization is very much important to correct the musculoskeletal disorders. For example, knee osteoarthritis associated with heel pain, tightness of hamstring and tightness of calf muscles. So by using of this acupuncture, we can mobilize our soft tissues. So these are the examples of soft tissues in our body. There is muscles, tendon, ligaments, fascia. These are the main soft tissues. So these tissues can be tight with the aging or with the non-utilizing the tissues properly due to the lack of exercises in daily living. So these tissues can be tight and there can be reduction of joint space, which is most important for the degenerative diseases. And this shortening of joint space will lead to the degeneration of joints and the deformity and the formation of trigger points. So we can use effectively the soft tissue techniques with the acupuncture. So there is a RC point. So soft tissue mobilization can be done with the help of acupuncture. So my study was on the knee osteoarthritis. I have included 15 patients at the Life On Integrated Therapy Clinic, which is in the New Town, Kolkata. So I have inserted acupuncture needles at the tight hamstring muscles to soft the muscles. For that, we can get the maximum benefit with the cases of osteoarthritis. So, how acupuncture will work in this soft tissue mobilization? So, soft tissue tightness is the main cause for the deformity and the joint space reduction. So, acupuncture can help to mobilize the tissues by the elevating the trigger points that can be found at the aging or old hamstring muscles, or those are working with the sitting working for the long time. So this condition can be treated by the acupuncture. So there is a very significant point called RC point. So RC point is the RC points are the very significant to release the trigger point or torque band that can be soften the hamstring muscles as well as calf muscle. So knee osteoarthritis pain can be reduced by the loosening of hamstring and the strengthening of quadriceps. So the main culprit for the OA osteoarthritis is the hamstring, not the quadriceps, because hamstring muscles are tight, so they pull upward tibia. So tibia will be shifted upward for the tightness of the hamstring muscles. So hamstring muscles is loosened after the acupuncture. Then it can be easier to manage the symptoms of the osteoarthritis of the knee joint. So I have integrated acupuncture with the physiotherapy and the stretching exercises. So it gets excellent results, and within the 15 patients, they have 13 patients are improved better, and 2 patients they minimize their symptoms. So this is an important tool, and that is also, so this is the soft tissue mobilization that increases the muscles pliability. Pliability means softness. So it is the very important, and after that, next slide. So after that, this is the objective of my study, that is to stimulate the AC points and to eliminate the osteoarthritis knee pain and the heel pain. Next slide. So this was the treatment procedure. So acupuncture, physiotherapy, and stretching stage, and the sample size was 15 only. Next slide. So after the 3 treatment session, after only the 3 treatment session, the hamstring muscles and the calf muscles were loosened. So tightness were reduced, so that the joint space and the joint mobility will also increase. So the crepitus sound of the joints, or the cracking sound of the joints already reduced after mobilizing the hamstring and the calf muscles, gastrocnemius and soleus muscles. So this is a very useful technique to manage the osteoarthritis knee joint. So this is the last. So it is an effective tool for the knee joint osteoarthritis management with the acupuncture. Next slide. Thank you.
One question, sir. Only 140. Yes, sir.
Yes.
So would you please discuss what is the difference between trigger point and nasi point?
So AC points are the mainly painful points. We have to find out the painful point, more painful points of the muscles, and trigger point or also that the taut band or the more painful point. So there is a significant difference. I think both are same. AC points and trigger points both are same.
What is the difference? Tell the difference between these 2 points.
Yes, sir. No. Main culprit is the hamstring muscle. Hamstring muscle first get tightened, then the quadriceps get loosened. So in the OA knee patients, quadriceps muscles are loosened and the hamstring are tightened. That's why the joint space is reduced.
Thank you all of you. No more questions? Lunchtime.
We are running out of time, so please, next, Dr. Ruchita Chopra, effectiveness of acupuncture for acute intraparenchymal hemorrhage. Time is sharply 8 minutes. Don't exceed your time so that we can start our inaugural session next after 2 days.
Hello everyone. This is the first time to share my experience.
Take your seat, please.
First of all, Thank you so much for this opportunity. And the ADM staff, my teachers, Tapan sir, Bakshi sir, Sujata ma'am, Bhatt sir. Thank you so much, Penaki sir, to support me. Okay. Actually, during COVID time, uh, मेरे नेबर में रेजिडेंट हैं सोसाइटी में, उनको कहीं एडमिट नहीं किया गया। उनको स्ट्रोक आया आधी रात को और कहीं भी एडमिट नहीं किया गया। तो वो वाला केस मैंने हैंडल किया, तो वही एक्सपीरियंस मैं आपको शेयर कर रही हूँ। तो मैंने कैलकाटा कॉल किया कि सर मुझे सपोर्ट कीजिए। देन दे सेड यस यू कैन डू दिस, क्योंकि कहीं एडमिट नहीं हो रहा था। वो बेचारा 2 दिन तक स्ट्रेचर पे रोड पे ही था। और एंड स्पेशल थैंक्स टू सुनील भल्ला, उन्होंने एक्यूप्रेशर किया और साथ में उनको सारी एक्सरसाइजेस वगैरह भी साथ साथ करवाई। अभी वीडियो नहीं चल पा रहा है, नहीं तो आप उनका रिकवरी और सब देख सकते थे। ये जो उनका प्रॉब्लम था दैट इज IPH, इंट्रापेरेन्काइमल हेमरेज। इट इज अ ब्लीड दैट टेक प्लेस इनसाइड द ब्रेन parenchyma, which is made up of the functional tissue consisting of neurons and glial cell. Actually, जब मैंने ये केस लिया तो मुझे नहीं मालूम था कि ये प्रॉब्लम एक्चुअली क्या है। मुझे सिर्फ यही पता था कि ये स्ट्रोक है, और क्योंकि कोई CT स्कैन नहीं हो पाया था, कुछ भी नहीं हो पाया था, और बस वो हिल नहीं सकता था, अपने हाथ पैर नहीं हिला सकता था और बस बेहोशी में था। तो CT स्कैन के बाद ही हमें पता लगा दैट इज IPH. It can arise due to various reasons such as tumor, rupture, infection, high blood pressure, and trauma. It was due to high blood pressure, of course. One of the most devastating strokes, which comes after spontaneous intracerebral hemorrhage. IPH is associated with highest mortality rate and the high morbidity rate, which is why this makes it crucial to identify that the management of IPH in the dedicated stroke care. Acupuncture is the part of traditional Chinese medicine and a form of alternate medicine. It has been recognized as an independent medical system in India, the Ministry of Health and Family Welfare. This is just an introduction actually. And the material I used, that is acupuncture needle, plum blossom, moxibustion, tense, और yes, of course fire needling भी मैंने इसमें यूज किया है। एक्यूप्रेशर भी यूज हुआ है बहुत अच्छे से। एक्यूप्रेशर के बाद ही हमने हैमर किया और उसके बाद उनको एक्सरसाइजेस वगैरह कराई। एक्यूपंक्चर तो साथ साथ चल रहा था, और जो रिजल्ट था उस ट्रीटमेंट में, दैट वाज वेरी मिराकुलस। The results of the treatment in first 10 to 15 days included minimum muscle improvement. बिल्कुल जरा सा हिलना शुरू किया था उस बीच उसने। The subject faced difficulty staying in an upright position and could barely lift his legs and arms. Additional 10 days of treatment allowed the subject to sit in an upright position without facing much difficulty. And within 1 month, he could walk. Result of additional 30 days of treatment, including ability to walk without any support. तकरीबन 60 to 70% वो हील हो गया था और उसने साइकिलिंग भी स्टार्ट कर दी। एंड द मोस्ट सबसे अच्छा ये था कि उसने अपना जॉब भी वापस स्टार्ट कर दिया था। The treatment made the subject to recover a significant amount of physical movement as well as spontaneous tremor the subject was facing during the recovery period. However, the subject complained and having numbness और बाद में जो भी sensation of food था वो भी धीरे धीरे उसका ठीक होना शुरू हो गया था. And the conclusion was acupuncture may promote the motor function recovery of hemorrhage stroke patient is an acute phase. मैं वीडियो नहीं दिखा पा रही उसके लिए माफी चाहूंगी और टेक्निकल इशू है थोड़ा सा. थैंक यू सो मच फॉर लिसनिंग.
Now I request the chairpersons to please hand over the mementos to the speakers. Dr. Probit Banerjee. Dr. Probit Banerjee, please come in. Next is Dr. Buddhadev Nath. Dr. Buddhadev Nath. And Dr. Rosita Chopra. Dr. Bhavani Prasad Sahu, please come up to the stage to felicitate the chairperson. Dr. Bhavani Prasad Sahu, one of the most veteran acupuncturists, and he has been the head secretary of AI at present, the vice president, and the main man behind the Journal of Acupuncture, JAI, the editorial board. So he is one of our renowned acupuncturists in India as well as in West Bengal. So next we'll move on to the inaugural session. We are running a bit late, so first I request our volunteers to please bring to the stage our Honorable Minister, Dr. Mrs. Shashi Panja. Has she arrived? Dr. Mrs. Shashi Panja. So please get the stage ready, put on the nameplates and the books. I think she is not yet present. So I will request the senior persons or the volunteers to please bring onto the stage those we have got. I request Dr. Gadhait or Dr. Bhattacharya to please bring onto the stage our guest of honor, Qin Yun, the acting consul general from China, the Chinese consulate of Calcutta. The acting consul general, Qin Yun. Sir, please. Next, please. Next, I request our Honorable DHS, Dr. Siddhartho Niyogi, Dr. Siddhartho Niyogi sir, our Honorable DHS, Director of Health Services, West Bengal, Government of West Bengal, to take his seat on the dais. And next, I request Professor Dr. Devashish Bhattacharya, our Honorable DME, the Director of Medical Education, Government of West Bengal, to come onto the stage. And also, I request Dr. M.N. Gatai, the President of AI, Dr. M.N. Gatai, Dr. Bhaskar Jyoti Bhattacharya, Dr. Bhaskar Jyoti Bhattacharya, Dr. B.P. Shahu, and Professor Dr. Suranjan Das, Professor Dr. Suranjan Das, the Honorable VC or the Vice Chancellor of the university you are sitting in, Jadavpur University. The Honorable Vice Chancellor, please come on to the Dr. Bhaskar Jyoti Bhattacharya, কোথায়? Dr. M.N. Gatai and Dr. B.P. Shahu. Dr. B.P. Shahu, so all the dignitaries are on dais. I don't know whether Dr. Mrs. Shashi Paja will be coming, but let us start our inaugural session. And first we have within us the Honorable Acting Consul General of Chinese Consulate in Kolkata, Dr. Chin Yun. Dr. Chin Yun, a loud hand for him, and I request Dr. Rakhi Banerjee. Dr. Rakhi Banerjee, please felicitate our honorable guest, Dr. Chin Yun. Dr. Rakhi Banerjee, please come to the dais. Take hand. Next, I request Dr. Shurpan Roy to felicitate Professor Dr. Devashish Bhattacharya, the Honorable DME, Director of Medical Education, Government of West Bengal. I request Dr. Pradeep Das to felicitate Dr. Siddhartho Niyogi, our Honorable DHS Sir, Director of Health Services, Government of West Bengal. Next, I request Dr. Tapos Das, to felicitate Professor Dr. Suranjan Das, the Vice Chancellor of Jadavpur University. Now I request Dr. M.N. Gatai, President of AI, will be felicitated by Dipti Srimani. Dr. Bhavani Prasad Shah will be felicitated by Atin Jashu, Dr. Atin Jashu. Dr. Bhaskar Jyoti Bhattacharya will be felicitated by Riman Das. And last but not the least, I call upon Dr. Hiralal Samant to please come up to the dais. Dr. Hiralal Samant, Director of B.K. Basu Memorial Research and Training Institute of Acupuncture, please come up to the dais. Next. And last, Dr. Hiralal Samanto. Dr. Hiralal Samanto will be felicitated by Dr. Pravi Kumar Banerjee. Dr. Pravi Kumar Banerjee. So please be fast. We are getting delayed. So we start the inaugural session by opening stotra by Dr. Devashish Haldar. Just 1 or 2 minutes of stotra, and then we'll get into our inaugural session.
বিশ্বে অমৃতস্য পুত্রা আয়তমানি দিব্যানিতস্তু শ্রীণন্তু বিশ্বে অমৃতস্য পুত্রা আয়তমানি দিব্যানিতস্তু বেদাহমেতং পুরুষং মহান্তং আদিত্যঃ বরণং তমসা পরস্তাৎ তমেব বিদিত্বা মৃত্যুহেমেতি নন্হপন্থা বিদ্যতে অয়নায় নন্হপন্থা বিদ্যতে অয়নায় নন্হপন্থা বিদ্যতে অয়নায় শ্রীণন্তু বিশ্বে অমৃতস্য পুত্রা আয়তমানি দিব্যানিতস্তু বেদাহমেতং পুরুষং মহান্তং আদিত্যঃ বর্ণং তমসা পরস্তাৎ তমেব বিদিত্বা মৃত্যুহেমেতি নন্হপন্থা বিদ্যতে অয়নায় নন্হপন্থা বিদ্যতে অয়নায় নন্হপন্থা বিদ্যতে অয়নায়।
Thank you, Dr. Haldar, for your nice recital. Next, I'd request the President or the Chairman of this organizing committee, Dr. B.P. Shahu, to address or present his welcome address. Dr. B.P. Shahu, the Chairman of this organizing committee.
Honorable dignitaries of the dais and respected friends, it is a nice moment for us to meet here in this 19th National Conference of Acupuncture Association of India, or AI. Towards the end of 2019, AI was having its 7th National Symposium in Lucknow, Uttar Pradesh. One proposal came of holding this 19th conference in Havli, Karnataka in 2020. But AI proposes, COVID disposes. Within few weeks, disastrous COVID pandemic and overwhelming lockdown started. Everything came to a halt. And overcoming that crisis, we have now been able to organize this conference in Kolkata under the auspices of West Bengal State Branch of AA. This venue of Jalapur University has also an important place in the history of development of acupuncture system of therapy in India. It is the first university of our country to start acupuncture training program for doctors in 1981 under its adult continuing education and extension program. A scientific and informative exhibition on acupuncture was arranged there in the Indian Science Congress arranged in Jalapur University campus near that time. That was for the first time in the history of Indian Science Congress. All these had been possible due to endless encouragement by Dr. Vijay Kumar Basu, pioneer of acupuncture system of therapy in India and founder president of AI, and valuable cooperation from Professor Dr. Amarendra De, Guru Nanak Professor of History of Jadavpur University. We humbly and respectfully remember them. Also, we remember some of our friends whom we have lost during the COVID period. And now, with those memories, this national conference of AI is going to start with valuable presence of all of you. On behalf of all members of the organizing committee of this 19th National Conference of Acupuncture Association of India, I hereby cordially welcome you all.
Thank you, Dr. Shahu. Next, I request the General Secretary of AI, Dr. Bhaskar Jyoti Bhattacharya, to address this august gathering.
Respected dignitaries, our DAB, DHS, and Vice Chancellor of Jadavpur University, and President of AI, and President, Chairman of the Organizing Committee, and all the members of Organizing Committee, and all my friends sitting here. First of all, I am feeling very proud that after just 3 years, we are holding this conference, and there is a fabulous attendance from all the parts of India. So I think that still now, people are thinking of acupuncture, people dreaming acupuncture, and people work for acupuncture. You people come from different corners of the country with different, many inconveniences, and you come here to attend the conference. So I hope the flag of acupuncture is marching ahead. And it is a matter of pride for all of us that we are holding the life for the long years with the inspiration of Dr. D.K. Basu, the founder of acupuncture in India, and it is burning with good flame till date. And I hope this conference will provide some valuable information, some valuable papers, and which will help all of us to improve ourselves. My humble request to our administrative persons that please think for the propagation of acupuncture in our state and also in India, so that this very cheap and useful treatment can spread to every nook and corner of the country. But standardization is very important. We are still not getting the central council. National council is there, but everything is running with a very less momentum, which is not expected. So my appeal to all that let the inertia to be transmitted to all over India, all over West Bengal, so that we can practice the method in our people with great vigor. Thank you.
Thank you, Dr. Bhattacharya.
Sorry, I have not uttered the name of Deputy Consul General. I am sorry for that. He is one of the person dignitary present here. Thank you.
Thank you, Dr. Bhattacharya. Now I request the President of AI, Dr. Raman Gatai, to please present a few words.
Honorable dignitaries of the dais, my professional friends and guests, the first university level acupuncture course was started here at this Jadavpur University in 1980, and Professor Lu Ji-chun, President of China Acupuncture Association, graced that occasion here. So it is a matter of pleasure that we are holding the conference again at Jadavpur University. Dr. Basu, D.K. Basu, was the father of acupuncture in India, who introduced acupuncture to India in 1959 in Kolkata. After learning it from China, he introduced acupuncture here in Kolkata. Dr. Basu was a member of the historic Indian medical mission to China, who went to help the Chinese people fighting hard against Japanese invaders. Eventually, Dr. Courtney's, another member of the medical mission, had to sacrifice his life on the soil of China. According to Dr. Basu's wishes, his residence house has been donated to West Bengal Government Health Department for development of acupuncture. At this house, this residence house of Dr. Basu, now is situated the sole in whole India, the only government acupuncture institute is at this premises of Dr. Basu. West Bengal government is the first state of India to give legal recognition to acupuncture through the Acupuncture Act 1996. We are aware that West Bengal state government is very congenial to spread and development of acupuncture. Acupuncture is a very low cost but effective therapeutic modality. We are happy by the presence of Acting Consul General of Chinese Consulate Kolkata, Mr. Chin Yun, to grace us here, and we are aware that the Chinese Consulate, Consul General Mr. Cha Liu and all others, they are very much keen to propagate, to develop acupuncture, at least in this part of India. I here in this scope, I make an appeal to Professor Devashish Bhattacharya, Director of Medical Education, and Dr. Siddhartha Niyedi, the Director of Health Service of West Bengal Government. They both are top persons of the West Bengal Government Health Administration. I request them to set up one permanent exhibition on life and activities of Dr. Basu and history of acupuncture in India at the former house of Dr. Basu, which is now the government property. From Acupuncture Association, we are ready to extend all our cooperations in this regard, and I have been informed, I asked the director, I have been informed that there is enough space for making this permanent exhibition on Dr. Basu at the institute premises. And so that will be not the problem. And if it is done, I think that place will be the pilgrim for all acupuncturists of this subcontinent. Let the conference be a success. Thank you all.
Thank you, sir. Next, I request Professor Dr. Suranjan Das, the Vice Chancellor of Jadavpur University, to please say a few words on this occasion.
His Excellency, the Acting Consul General of People's Republic of China in Calcutta, Honorable Director, Medical Education, Government of West Bengal, Honorable Director, Health Services, Government of West Bengal, esteemed members of the organizing committee of this conference and other office bearers of the Acupuncture Society of India, and of course distinguished members of the House. Could I, on my own behalf and on behalf of the entire Jadavpur University community, sincerely thank the association for choosing Jadavpur University as its venue for this conference. As has been mentioned, Jadavpur University has established its commitment for the popularization of acupuncture in the country, and we remain committed to that. And I can assure you that if the Acupuncture Association wishes to conduct courses, to make awareness program, Jadavpur University will always be by its side and render all possible assistance.
I won't take much of your time except to stress 2 points. One, acupuncture has created its own niche in the world of medicine as the most cost-effective and medical effective treatment. But unfortunately, it has not yet attained the sort of popularity that it should have in India. And it is our duty, particularly people from Bengal, to ensure that acupuncture receives its due place in the medical world. Because the person who initiated acupuncture treatment in India comes from Bengal. And we should remain committed to preserve its legacy so far as acupuncture treatment is concerned. The other point that I would like to emphasize and end is that as I see it as a student of history, acupuncture does not merely have medical relevance and importance in India, but acupuncture also remains an essential ingredient for the continuation of the rich legacy of Indo-Chinese friendship. Acupuncture has provided an important link for historic connection between these two neighbors. And I think in this world, when we are looking for a better world order to live in, the friendship between India and China, the two greatest civilizations in the world, needs to be promoted on a more effective basis. And acupuncture can provide us with an important entry point and an important link. With these words, could I once again thank the organizers for enabling me to be here, and I wish the conference all success, and I'm sure it will be able to bring to the platform a number of experts whose deliberations would be academically fruitful and practically effective. Thank you very much.
Thank you, sir. And now I'll call upon our Honorable DME, Professor Dr. Devashish Bhattacharya. He is also the President of Council of Acupuncture Therapy in West Bengal.
Good morning. It's really a pleasure to be present among all of you in this beautiful morning. And I really welcome our Honorable Consul General for this program, Honorable Vice Chancellor of Jadavpur University, Director of Health Services, and all my friends in the profession of acupuncture. What I want to mean that, truly speaking, acupuncture, what Honorable PC has said, has not gained the proper honor what it should have. Quite naturally, in the field of knowledge, there should not be any boundaries. The question of cross-pathies have come in our ideas so that one cannot practice the other things, and that becomes legally incorrect. But if you think the concept of knowledge, truly speaking, there should not be any boundaries. We have just finished Durga Puja, and if you just close your eyes and visualize Mother Durga, you will find the main work is done by the potter. But the mother's sari, ornaments, and so many other instruments, what she is holding in her 10 hands, are prepared by different artists. And all make Mother Durga such a pleasant, beautiful way of Jagat Janani, or the Great Mother. So quite naturally we can understand, to give health in totality, doctors from different fields should work together But these days, we do not believe in somebody's ideas only. We believe on the evidence-based medicine. So, I will request Honorable Vice Chancellor, Jadavpur University, and also I will request our University Health Sciences Vice Chancellor Madam, and also McCouten and so many other universities which are there in Bengal, to come to a platform where people of different fields can work together to develop a research areas where these problems can be solved in a proper evidence-based medicine, and people will be able to know the importance of acupuncture then, when it will be proved beyond doubt that it really does something beautiful. I wish and pray to Almighty that let He gives us strength so that we can really come forward, working together for the betterment of the human health and our people of India and if not of the whole world. I wish that this workshop will give us some insights and give some resolution to the government of West Bengal, Department of Health and Family Welfare, some suggestions which can be implemented properly. And regarding the museum, I have already given my words that I will visit that place and will look into it so that the museum is developed. Thank you, sir.
Thank you, sir. Thank you so much. Now I request Dr. Siddhartha Niyogi, our Honorable DHS, Director of Health Services, Government of West Bengal, to please speak a few words. Sir.
Good morning to everyone. So it's my pleasure to attend this conference, and I thank the organizer for inviting me and always reminding me for I think more than a month. So the person is sitting here. So anyhow, the Consul General, Acting Consul General from China, thank you for coming here. The Vice Chancellor of Jadavpur University, Director of Medical Relations, and other office bearers, eminent persons from acupuncture therapy, and the delegates seated of the dais. So, I will just elaborate my experience of acupuncture. I was posted as superintendent in Hooghly District Hospital. So there, one day, one doctor was, acupuncturist was posted there. So I thought he will do it here, but I am not seeing it now. Anyhow, so I think he has been posted outside. So anyhow, sir, we want a place for acupuncture. So acupuncture room is required. But in district hospital, so many places are not available always. So I told them, so this OPD will be cleared first. So after that OPD hours, you do it at your will and I will help you. Then only I could know what is acupuncture. So I asked him, what you do? What is acupuncture? So he showed me some details. And I also went to that clinic where they were doing the job. So I had some experience, practical experience of how acupuncture is done. So it is a very new thing I learned that there are some pressure points where you can puncture with a needle and give it to the patients. So Dr. Goodnight gave me a book. So where you can do the acupuncture therapy. But it is my request to you all that in geriatric medicine, and especially persons suffering from cancer, and we require some palliative therapy for those patients. And sometimes it is difficult, and giving painful drugs, morphine tablets are given, even some patches are applied, and some nerve block are also done in our system. But can acupuncture help it to relieve the pain of these patients?
Definitely.
Tell it loudly, don't I can. Yes. So I will request who are related to the acupuncturist in our system, in the health system, to meet me so that I can include you in the palliative care treatment.
Along with the pain, actually different things are also can be
I can't hear you.
along with the pain, the different other things can also be relieved.
That is fine. But most problem is their pain and other, I should say, problems they face after the chemotherapy or radiotherapy. So that if that is really, that is a very help to the patients, palliative care patients, and also for geriatric patients. Yesterday, I and DAG also attended a conference for geriatric which is going on in Vishwabangla conference. So I request you, how can you help this? Give me a brochure, a write up with some few pages, so that we can do it. I think DAB will also agree with me.
So I would request our present director of
Please stop. Sit here, don't talk.
Anyhow, so this is coming up. So I think in future, combination of treatment, we are not saying that we are the director of health service of only allopathic treatment. We are director, I am director of health service of Ayush also, acupuncture also, and other system what we are running in a big way. So here, you should also come in the help, and everyone should work together. The aim should be to give relief to the patients. That should be the motto. So if we can give that faith to the patients will come to us to have relief. So I wish your National Conference of Acupuncture of India a success, and I will hear from you later what was the outcome. I again thank the organizers for inviting me here. Thank you all.
Thank you so much, sir.